myself, Dr. Sabyasachi Pal. I am working as a senior consultant cardiologist in BM Birla Heart Research Institute. So our topic of discussion today is resistant hypertension. By definition, we call it resistant when the at least 3 antihypertensive cannot control the blood pressure, of which at least one antihypertensive should be diuretic. If I simplify it, when the patient is taking antihypertensive and he is having the full dose of 3 group of antihypertensive, I mean the calcium channel blocker, the beta blocker or the sartans, still now his blood pressure is not controlled. So in this group of patients we call it resistant hypertension. There is a multiple of cause, but majority of the time and most frequent, that is the compliance issue. It means the patient has been advised to take the medicine, but probably patient is not taking the medicine sincerely or seriously. This is the most common cause. Another common cause that the patient is some problem that he faces after the continuation of antihypertensive. Say the one group of medicine can cause swelling of the legs, so patient without informing anybody stop the medicine, so this can cause the ineffective control of blood pressure. Another group of problem is that diet. In few group of patients, it has been seen that they consume lots of salt containing foods, and in our Indian food habit, there is also a group of patients and group of populations, they are also habituated in making the domestic in the food in such a way that contains very high salt. So high salt containing food is one of the causes of this resistant type of hypertension. There are multiple diseases upcoming. One of the disease, that is obstructive sleep apnea. There is a person, elderly, relatively obese, who snore at night, snoring in the night, and there is a multiple other criteria. Not every person who snore develops this obstructive sleep apnea. Is actually the disease. It is usually seen relatively elderly, obese, and patient who snores at night. Not every snorer is having this sort of obstruction at the night, but majority of the patient who is having the obstructive sleep apnea, it has been seen they snore at night. And also there is some daytime fatigueness or some daytime somnolence. It means that they frequently go into sleep in the sitting position or reading newspaper, watching television. So obstructive sleep apnea is nowadays one of the very common cause of this resistant type of hypertension. Apart from this, there is multiple hormonal causes, say the different one, aldosteronism, the Addison disease, the multiple different types of causes. So when you are getting patients where there is a problem in controlling the blood pressure, our first motto becomes to understand how the patient is actually measuring the blood pressure. So confirmation of the blood pressure, actually how much it is remaining, then taking the good dietary history, how amount of salt they are consuming, whether they are taking the medicine perfectly. If all these things is normal, when we call it resistant type of hypertension, we first exclude all these things, renal, this endocrinal, and also the obstructive sleep apnea, and accordingly we treat the patient. And actually the obstructive and all these things, the resistant type of hypertension, one group of medicine has been seen is very effective, that is the aldosterone antagonist. And nowadays there is a good amount of medicine has been in the market that can very easily treat the resistant type of hypertension. Thank you.